Welcome back. My name is Dr. Baird, and today I'll be covering 5 skills that every adult should learn to fix lower back pain and prevent lower back pain from getting worse as you get older. So let's get right into it. The most important skill for any adult to learn to prevent lower back pain as you get older is how to find and keep a neutral spine. So the neutral spine is just the position of the spine where the least amount of impact goes through your discs, your joints, and other structures of the spine. And what you'll notice is that it does not mean a straight spine. Your spine naturally has 3 curves, a lordotic curve in the back, into a kyphotic curve in the mid-back, back to a lordotic curve in the neck. And the key is learning how to maintain this position as you move throughout your day or start any strength training routine, which is what we'll look at next. To find your neutral spine, all you're going to need is a PVC pipe or something else that you can place along your spine, and you want it to touch 3 points. First, the back of your head, next, your mid-back, and then your sacrum or pelvis area. And so what you'll notice is that I do have a gap in the lower back, and I do have a gap at the neck. That is normal. And so the key here is going to be how to maintain this position as we start doing more dynamic movements, as you go through your day, to avoid too much impact on your back. And in the next 4 skills, we'll talk about a few of the main things that cause you to lose this neutral spine and how you can fix it. The next skill that you need to learn in order to prevent lower back pain as you get older is how to control your pelvic movement. So improper pelvic movement is one of the most common ways that we lose your neutral spine. So just so you can see, you've got your spine, and this whole area, both sides, is what we call the pelvis. And what happens is if you rock your pelvis forward, that creates extension in the spine, which is going to irritate these joints in the back. Or maybe if you sit a long period of the day, the pelvis can start to round backwards, which, as you can see, is flexing the spine and putting more impact on the discs. And again, these are things that you might not feel right away, but times this by many months and many years, that is when we start to experience this pain as we get older. So let's go ahead and look at how we can gain control of our pelvic movement. To learn how to control your pelvic movement, there's 2 exercises that I like to go over. The first is simply taking your pelvis through its full range of motion. So you can do this standing, you can also do it laying on the ground. And all you're going to do is, standing in your neutral position, you're going to start by rocking your pelvis forward. That exaggerates the arch in your lower back, and it probably feels a little bit uncomfortable because, again, it's compressing those joints like I just showed you. And from there, you want to practice rocking your pelvis back. And so all you're doing is getting a sense of this range of motion and paying attention to what feels good and what feels bad, and then finding that position right in the middle that has the least amount of discomfort. Now, the second thing you can do to find your ideal pelvic position is a simple glute squeeze. Again, you can do this on the ground. I'll do it standing. But your glutes are these big muscles that surround the pelvis. And so if your pelvis is rounded forward, when you squeeze those glutes, it's going to pull your pelvis into proper alignment. And that's going to set the foundation for a strong spinal position that's going to help all the way up your spine. The next skill that you want to practice to help maintain that neutral spine is a simple abdominal brace. So it's obviously hard to just consciously think all the time, well, is my pelvis this way, is my spine in that position? The abdominal brace helps because it's going to pull everything into the right position. So to perform, it's really easy. All you're going to do is do a light contraction on your abs. I would say about 25%. It doesn't need to be a full bearing down, but it's almost like you're bracing. If somebody were about to punch you, how you brace your abs to absorb that impact, that is an abdominal brace. And the benefit of this is, again, it's going to hold that spinal position. So this is really good as you're going throughout your day, but especially in your strength training routine. Anytime you're going to start lifting a heavy weight, it's good to practice that abdominal brace so that you can maintain that neutral spine as you perform the exercise. The next skill that you want to learn to prevent lower back pain as you get older is how to control your glutes. So as I mentioned before, your glutes are the muscles that surround your pelvis and your hip and are very important for setting that proper spinal foundation for less impact through your spine. And one of the common things that I see and hear in my clinic is that people have a hard time engaging their glutes. And that's going to be a problem because then you can't set that foundation. So there's a few ways to activate your glutes. Where I like to start a lot of my clients is with an exercise called the glute squeeze and release, where you just lay on your back. And the first thing you're going to do is try to squeeze those glute muscles. And you can tell your hips will rise a little bit off the floor. And from there, you're going to release your right glute muscle, keeping your left contracted. So my left will stay elevated, but my right drops. And then relax the left. And then you're going to do the same thing where I'm going to squeeze both. Now I'm going to let my left relax. So it'll drop while the right stays contracted. And then drop. Now, if that's a little bit too difficult, another great exercise to activate the glutes is a simple glute bridge. So on your back, hands at about a 45 degrees. You're going to press through your feet to lift those glutes up. And again, you can kind of press on your glute muscles to make sure that they're engaged. And lastly, if you can't do it with the glute bridge, you can try the glute raise, which is just going to be on your hands and knees. You're going to keep that leg in a nice 90-degree position and raise it up off the floor. And again, you want to feel that activation in the glute muscle there. So give that one a try and practice controlling your glutes. And the last skill that you'll want to master in order to prevent lower back pain as you get older is diaphragmatic breathing. So breathing is an important movement pattern that we perform over 50,000 times a day, and it's important that we get it right. And so to perform diaphragmatic breathing, all you're going to do is lay on your back. You're going to put one hand on your chest, one hand on your belly, and you're going to take a deep breath in through your nose. And what you want to pay attention to is as you take that deep breath in, you want your belly to elevate, and that'll be your diaphragm coming down. And so what we want to avoid is chest breathing, where when I take a deep breath in, it's my chest that rises. And so that's why I like my hands as kind of markers. And so what you'll do, you'll take a deep breath in through your nose, and you can see that it's my belly that rises first. And then same thing on the way out, you just let it out, nice slow breath, and let the belly relax into its natural position. Not sucking it in, just letting it relax. So one more time, deep breath in and out. And that is diaphragmatic breathing. So there you have it. That is 5 skills that every adult should learn in order to prevent lower back pain as you get older. As you can see, it's really not that much. This can all be mastered in a day. The key is implementing it into your everyday life to limit impact that goes through your spine so that you have less pain, less arthritis as you get older. Again, my name is Dr. Carl Baird. Thank you so much for watching my video. If you have any questions, comments, leave them in the comments below. I do read them and I do answer them if I can. Thanks again.